Happy Friday, everybody. Welcome to everybody's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, Bradley Cooper in the news. Plastic surgery rumors. Did he have it? Not so fast, my friend. I got something to say about that. And then, working out in middle age. You got to do it smarter, not harder. I'm going to break it down. And then finally, a surgeon facing jail time for letting her daughter operate on a patient. What? We're going to talk about it. It's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer, Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please crush that like and subscribe button and turn on those notifications. I'm your host, plastic surgeon Dr. Bruce Hermann. With me, Sarah. Made
Howdy.
it in.
Hi.
Through the storms.
Yeah.
At a girl.
Yeah, it's
No
supposed
problems.
to be pretty gross tomorrow.
It is supposed to be gross. Yeah, it's supposed to be nasty. That's bad because we're having people over tomorrow.
Or tonight. It's always at night.
I know. Brenna, what's up? How you been?
Hello, I'm good. How are y'all doing?
I'm doing
Good.
great. How's
Doing
life?
good. Doing good. I'm loving the rainy weather, but it makes me want to just sleep all day.
And watch Harry Potter.
I know,
Yes.
right? Hey, you're coming over the outside too, Brenna, just FYI.
Oh, okay.
Yeah.
I'll fix that.
Yeah, no worries. All right. So, sorry, I didn't mean to like get technical on you there. I'm glad you're doing good, Brenna. All right. Thank you, Sarah, for bringing up a story that I missed about actually one of my favorite actors. So, and this guy is one of my favorite. I got like a
Bradley Cooper.
I got like a bro crush on this guy, you know.
He's a handsome fella.
He's very handsome, and he's always cool in his movies. So, like,
he always plays the cool guy.
He does.
The
I'm not like-
nonchalant cool guy.
I'm not a gay person, but Bradley Cooper like would be my
If you had to choose.
if I had to choose. Yeah, no, he's awesome. All right, so this is Bradley Cooper, plastic surgery rumors. What Bradley say it's not so. So this news actually hit a couple weeks ago, and somehow I missed it. After Bradley Cooper, who's 50 years old, and Gigi Hadid? Yeah, Hadid. Hit some big Vogue party, and of course, you know, they're taking all these pictures, and when the pictures hit the media, his fans kind of lost it because they said he looked unrecognizable and looked like Charlie Sheen. No, not Charlie Sheen. Wow.
Charlie Sheen always has like this confused look about him.
I know, right? He always looks like he's up to no good. And,
Yeah.
and that's probably true. Like,
Well,
I think,
it's because that's his history. I
think he's a little bit on the wild side, which that's cool. I like that. That's cool.
Yeah.
So, of course, the plastic surgery rumor mill fired up, and people were saying he had a facelift and a neck lift, and his eyelids done, and Botox and fillers and all this stuff. And there was actually two plastic surgeons were quoted in two different articles, and one was convinced that he had plastic surgery, and the other said he didn't. So we are going to be the judge today. All right, so let's throw up that pic again, Brennan, that second pic. Yeah, so he does look different, right? I mean, you guys know Bradley Cooper. That doesn't look, I mean, it is Bradley Cooper, but he looks different to me. Would you guys
Yeah.
agree? Like, doesn't look like himself?
He doesn't. He looks not Bradley Cooper-ish. I mean, I know that usually he has more scruff.
Yeah.
Yeah, I agree.
I think that's a lot of it too.
But there's another picture where he just looks, to me, looks completely off.
Really, because I looked through pictures last night for hours looking.
He has that he looks like his eyes are just like.
It may be one of the ones I'm going to show. I don't know. So I
looks
do want to
weird.
compare. I pulled a picture. I want to pull a picture from a little bit in the past. So I pulled a picture
From his heyday?
No, not from the heyday. I don't want to do that. I want to pull a picture from like a year ago. Yeah, just because, you know, if he had surgery recently, I wanted to compare it to more recent photos. This is last year.
Yeah. See, he definitely looks different because his beard is darker, and his beard on the other side is like
and his
light
hair is
and gray.
different too. You know,
Yeah.
his hair is different. But I do think his face looks different, and so I'm going to give people a pass on the rumor mill because I think to the untrained eye, you very well may think that he's had surgery. But if he had surgery, there's certain things that we would be looking for that I am going to go over with you guys. So a couple things, like I would want to see, speaking specifically to facelift and neck lift, I'd want to know a couple things. One, is there a change in like the jowling? Because that's what a lot of people, especially men, will notice, where they will start to be like, oh, I need to do something. So jowling is basically when the cheeks here, you don't have a clean like jawline, like this tissue starts to sag just with age, and you can notice that. And in fact, I started to get it like a year or two ago, and I think I've told you guys before, I did like a laser treatment, and like it went away because thankfully it was very, very subtle. So yeah, I totally get, why people want to fix that. The other thing I'd look for is changes to the hairline, because one of the things that a facelift does is makes the incisions along the ear, but then once you pull that skin, it pulls this skin towards the back of your head. And so when you're doing facelifts on men, you always got to talk to them about, hey, your sideburns, like they're gonna be like
different.
They're gonna be gone basically, depending on how much skin there is. And so that's one of the telltale signs I would look for, is like, can I see his hairline along his sideburn area? So I pulled some pics. All right, show that next pic, Brenda, if you would. Okay, this is the same photo shoot. All right, so let's start at the bottom. So if you look at the bottom arrow, it's pointing to that little kind of curve along his jawline. And I'm not picking apart Bradley Cooper here. Like, I mean, the guy's a good-looking dude. I already say he's my bro crush. So Bradley, if you're watching this, I love you, man. All right, so you see though that he's got like some jowling right there, okay?
Yeah.
Like that's what you would expect for somebody that's 50 years old. And so right off the bat, I'm like, okay, well, if he got a facelift, like he got a terrible facelift, because they didn't even fix the one problem that you would want to fix. Now, I know this picture probably doesn't look super crystal clear to us in the studio, but if you look at that second arrow where it says hair normal, I'm looking at his sideburn, and I'm looking at that clear space between his sideburn and the anterior or the front part of his ear. Like there hasn't been skin taken up there.
Right.
Like, so he did not have a facelift. I mean, I can tell you that. Looking for the eyelid, because he's always had a blepharoplasty or eyelid job. I mean, he's got like eye wrinkles. Like, I mean, I can see them even on this crappy monitor. So, again, it doesn't look like he's had his eyelids done. So, like this one picture here to me is basically proof that he hasn't had a facelift, he hasn't had a neck lift. I don't think he has eyelids done either, because if he did, they'd look different than they look now. So, looking at that, I mean, I think I can safely say I agree with the people in the camp of he has not had recent surgery. I mean, unless there's something else I'm missing, which I don't think I am, because I went through tons of pictures, like this guy's not had surgery. So, I think then the question is, okay, well, what's different about him? Like, I mean, and not to pick apart somebody for their looks, but like what started this rumor mill of, oh, Bradley Cooper's, had all this surgery? Well, I think you hit the nail on the head, Sarah, when you said he's clean shaven.
Yeah.
I mean, that makes you look different. Like if you're used to seeing somebody with like a beard, which he almost always has that like kind of scruffy goatee and like all of that.
Well, it's usually darker, and it just looks like it's gone grayer.
Yeah,
So it's not as prominent.
And it's really thin.
Yeah.
The other thing is hairstyle's a little bit different. I think that's why he caught the Charlie Sheen comments. Because a lot of times he has his hair slick backed, and now his hair is more like mine, where it's like short and kind of frazzled, and it looks different on him. But there is one thing I did want to point out. Go back, Brenna, to what is the next picture? I can't remember. Let's see. Is it?
That picture.
Oh, that's him. Okay, so that's him like a month ago, by the way.
That's the picture that I think he looks so weird in.
Really?
I think there's just something different about him.
I mean, his hair's different. I pulled that picture from about a month ago because I was like, oh, look, in this picture, he kind of looks like himself. And then, Sarah, you're like, no, he doesn't.
He just looks so glowy and like softened.
Yeah.
Like a soft filter on him.
Just like
smooth.
Just did this.
Yeah.
He looks like something just kind of just lightly.
But his eyes still have those like the little wrinkles by his eye.
Maybe he got like a really serious like laser.
Yeah, I mean, and I think, and I've said this before, I'm convinced that all celebrities
like one of the lasers that like after you do it, it looks like your face is melted off.
Maybe. I mean, I would not doubt it. One, you could never tell for sure.
Yeah.
Like you just can't tell for sure unless you see them right after it happened.
I
which
can
obviously,
believe it.
But
he got veneers.
he did do something
Veneers.
to his teeth. I remember reading
Veneers
that.
can change your face.
Well, I looked at that, and I'm looking at his face, and to me, like, at least his facial structure looks more like Bradley Cooper. Outside of the fact that his hair's different, and and again, his like beard is kind of patchy. But I want you to look at this picture from a month ago, and I want to compare it to the next picture. Brenna, throw up the next one. Okay, here to me, he looks totally different. So the white arrow, the top arrow, I'm looking at the area in front of his ear and under his cheekbone. To me, it looks hollowed out, like he looks thinner. And
Yeah,
then
he does look like he lost
and
weight.
then the black arrows, look how thin his neck is. Go back to the one where it's the side by side. It was like the second picture, Brenna. Yeah, look at the difference in his neck.
Yeah.
Like his neck is way thinner.
That's what I was looking at too. He definitely looks thinner.
He's lost weight. And then if you look at his body, go to the final picture, Brenna, the one where it's like the full length one where it's him and her. Well, it's kind of hard to tell in that picture. But when I blew that up, he looks like super thin.
Yeah, I bet it's for a movie or something, you think?
That's a great question. In fact, that's exactly what my wife asked because she came in.
That is a good point. It could be for a movie.
It could be. I was wondering, and my wife asked me that too. I was like, geez, I don't know what Bradley's up to. I haven't talked to him in a while.
Because think of like Christian Bale.
Yeah,
Like how he looked in Batman, and then he like did some other movie where he was like addicted to some kind of drug.
Oh, the other one was Matthew McConaughey when he did the one about what was it, Cowboy South 40 or I can't remember, the one about the medications. And he had
Yes.
I can't remember the name of it. But so I think that the reason that he looks so different is because he's lost weight. I don't know if he's been sick. I don't know if he's on the Ozempic. Maybe he.
The Ozempic?
Maybe the Ozempic is going around.
Got that Ozempic.
Maybe he is doing it for a role, but I think the combination of the weight loss, which hollowed out his face, the hairstyle change, and the beard makes him look like almost like a different person. And so I think that's your answer. I mean, all this talk about surgery is just, nonsense. I can't believe that one plastic surgeon was convinced he had surgery. I mean,
Yeah, the TikTok I watched, like the
British dude.
I don't know. He was just like, yeah, he has scarring right here. You can plainly see and like look like.
Dude, I think that guy's smoking crack, man, because he doesn't have the things I'd look for a facelift, neck lift. I mean,
Well, to like, if you want to spread misinformation, just go right to the internet.
and maybe he's doing it for clicks.
Yeah, for sure.
I don't know. But yeah, I do not think that Bradley Cooper has had recent surgery. So, all right, let me cap this one up. Brenna, today we're talking about one of my favorite actors, my bro crush buddy, Mr. Bradley Cooper. He was in an event with Vogue, and a bunch of pictures were taken, and internet went wild because they said he was unrecognizable. He looked like Charlie Sheen. A bunch of articles popped up. People were saying he's had a facelift, a neck lift, eyelid surgery. Found one plastic surgeon convinced he had surgery, another said he didn't. I was going to be the judge. So we looked at a bunch of pictures, and I came to the conclusion that he has not had recent surgery. And I based that on the fact that the things I would look for someone who's had a recent facelift, neck lift, or eyelid surgery were not there. He still has jowling in his chin, which is normal for his age. His hairline along his ear where the incisions for facelift, neck lift would be are normal, and they wouldn't be after the surgery. And he has the wrinkles around his eyes that he's always had. So just based on looking at a couple pictures, I do not think he's had surgery. We were then wondering, why does he look so different? Well, he has looked like he's lost a lot of weight. We don't know if he's on the Ozempic, if he's been sick, or as a lot of people have suggested, maybe he's just doing a role where he has to thin down, and this is just how he is right now. So it's a pretty good episode. You want to check it out, please go and find it on YouTube. So cool. All right, moving on. I got a topic that is near and dear to my heart. Sometimes I come up with these topics because I'm like, it happens to me, and I'm like, oh, everyone needs to know about this. So, I've been training for this half marathon, right? Been training for a long time now. It's been about 4 months. And so, yeah, I've noticed, because this is the most recent time that I've really worked out hard in like a long time. Like I've kind of worked out a bit in the past few years, but this is the first time I've really trained pretty hard for something. And man, I've noticed that my body is not taking it the way that it used to. So this is a segment about working out in middle age. Work smarter, not harder. I don't look as old as that guy, do I? Do I look as that old? No.
Definitely not.
That guy looks like he could be my grandpa. Like that's middle age crap.
The veins in his forehead they're looking at me.
He looks like
he needs Botox.
he looks
does.
stacked though.
I wonder if that's AI.
Probably.
Oh yeah.
I assumed
you never
it
know
was.
nowadays.
From you.
Sometimes I do. I kind of mix it up. Sometimes I'll fish up real pictures, and sometimes I do it. So I am not alone as a younger middle-aged person.
It's hard for me to work out.
No, I'm not alone. And people that do serious training. In fact, there were some studies out there. You guys will probably get a kick out this. That shows that middle-aged people, especially women, work out more than younger people, which is pretty interesting. I wouldn't have necessarily thought that was true. So why are middle-aged people? And when I say middle-aged, I'm talking like 40s, 50s. Maybe early 60s.
Because our metabolism goes to crap.
Well, that's
especially
for sure.
after
I
you
can
have
see
children.
that. And all
Yeah.
like the yoga classes and Pilates, I feel like that's a very, men can do it too, but I feel like it's mostly women who do those classes.
Like social thing.
Yeah, like cycling,
Yeah.
yoga, Pilates. I've seen a lot of like the hot mat yoga. I think
Yeah,
that's
that's really big right
yeah,
now.
that's really trending right now.
Yeah.
So
Well, there are a lot of people like in the 40, 50, even early age brackets that are working out. There's a lot of reasons for it. People are living longer. People are, being active in older age. Also, you got to think who these people are, man. Like we're Gen Xers and like early millennials. Like we grew up in the 80s where you had to look good. I mean, I know that's not as big of a thing anymore, but we grew up. You still think it's a big thing?
Yeah, probably more so than ever.
I would disagree with that. I mean, I just having
don't
kids
know.
and like seeing, I don't know.
I think it's more acceptable to be like, oh, everybody accept
Yeah, that's the point.
everything. But to me, and especially just like watching my little girl grow up and the generation she's in.
Yeah, but she also
think
is
it's different.
she's taking after you, who is like, a fashion person and always like on point.
Oh,
I'm not sure that that's like the general populace because, I mean, I remember when I was growing up, I wouldn't go outside unless I was like, at least put together well. You never know who you might bump into your soulmate or something, man, and you don't want to look like a scrounge.
Yeah.
So I don't know. I do think that there's like a difference in the generations as far as like how willing they are to, present themselves well. I don't know. I may be wrong. I just kind of put that one down on my own. I don't necessarily have like a research paper that shows that. But to me, it's like the Gen Xers and the millennials, like a lot of them as like a group want to look good. There's also like all the health data that shows that, as you hit middle age, if you work out, like there's just vast improvements in almost every aspect of your life as far as, confidence, mental health, like, and then the more important medical things like cardiac, high blood pressure, diabetes, like
Right.
exercise helps all those things. So there's a lot of reasons why people, in my age bracket, it hurts me to say that I'm middle aged, but I mean, it's obviously true. In my age bracket are working out. So, all right, so you're a middle-aged person. Now, Sarah, this is not you, but like if you were a middle-aged person.
What's middle age? What's the age?
I don't know, I was gonna say like 40s and above.
Okay.
You
I'm
got a few
almost
years.
there.
You're catching up.
4 years.
Yeah, you're catching up. It sneaks up on you too, Bennett, so enjoy it while you're young, because you blink and you'd be like 100, just like me.
oh gosh, I'm almost 23, so I'm
I
enjoying
can't
it
even
while
remember
I
where I
can.
was when I was 23. I have to like check my calendar. Okay, so if you are middle aged, 40s and 50s, and you're going to go back to working out, maybe you worked out in the past, or maybe it's a new thing for you. There are a couple things you want to consider. I mean, first is, do you need to visit your doctor? I mean, that's like a real thing because, as we get older, there is a tendency for us to have, medical issues pop up, things we didn't have when we were young. And sometimes those can be affected or can affect your exercise or vice versa. So like, if you're a person 40s, 50s above, thinking about working out and you don't have any medical issues, you're not on medications, you're probably fine to skip the doctor, but it's always, not a bad idea to touch base with your healthcare provider if you have one you see regularly, especially if you have medical issues going on, just to make sure that, there's not going to be some issue there. You also need to consider like what you're going to do. I mean, when I was younger, I would do crazy, workouts that were insane stuff, like, even before the days of CrossFit, like running, the bleachers in August at like 2 o'clock in the afternoon. I mean, if I did that day, I'd probably die. You do need to kind of set, set your expectations of like what you're going to do.
Yeah, I was gonna say, especially if you've never really worked out consistently, like you don't know what you're doing in a gym.
Oh, then you definitely don't want to do anything crazy.
I would
Absolutely
suggest going to a class or getting a trainer.
Yeah, that's a great suggestion. Yeah, especially
like if you're not doing the right
you
form
can
on
totally
a
hurt
back
yourself.
squat, anything lifting weights, you could really hurt yourself.
Absolutely. I think that more along the lines of people, like myself, when I was like a crazy workout person in the gym all the time, and then I don't do anything for like 15 years, and then I get into it, and,
Yeah.
and you might think, oh, I can just jump back into, doing these crazy weight. I mean, you're gonna like kill yourself.
Yeah.
So you do have to think about that. So, and why is this so important? Because, the one thing that we want to do as we get up in the middle age is avoid injury, because we are a lot more susceptible to injury working out at our age versus when we're in our 20s or
Those knees, man.
early 30s. Yeah, right? Because you have just the wear and tear on your body over
My
the
knees
decades.
are starting to hurt.
Are they? Oh, man.
This one.
Mine's been holding out pretty good. Even I had a couple knee surgeries too. But, there is that wear and tear on your body over time. Also, you may have like old injuries that can be aggravated.
Yep.
We have a much higher risk of tearing muscles or tendons.
Yeah.
That's like a thing when you get older. In fact, I tore both my calf muscles, not this like go around, but like 2 years ago when I was training for something, and I wasn't even training as hard as I am now. And I tore both my calf muscles. I had to like go to an orthopedic surgeon, and they were
Did you
like,
overtrain or something?
No, so I mean, not to like derail my conversation on myself, but he was telling me, especially people that used to be pretty serious athletes when they were younger, and then they start working out when they're older, it's something to do with like the strength of the muscles and the tendons and how they change. Like they're very, very prone to like muscle tears.
Yeah.
And so he like basically said to me that, look, you need to be serious about your stretching. This happened because you're not stretching enough.
Right.
And so I had to completely, in the past I'd do like a couple stretches before I'd go run. Now I do like this whole stretching routine. Like it's ridiculous.
That's another thing I was about to say is recovery is very important as you get older,
Absolutely.
which includes stretching.
Yeah. So some of the culprits of injury, for working out as an older person, sudden intensity, you jump into something, right?
Yeah.
Just kind of like you were saying, skipping your warm-ups, skipping your stretches. And you have to be aware of this because, I had this happen to me. I had one injury, it basically derailed me for like a couple months.
Yeah.
You don't recover like you used to. So how do you avoid these injuries? Well, we already kind of danced around on it. Mobility first, stretching and warming up. Super important. I mean, it's important when you're younger. So, don't think that I'm here saying, oh, if you're a young person, you can just jump into stuff without stretching and
It's just less likely for you to get hurt.
Right, exactly. Your body can tolerate it better when you're younger. Like it's like a new car. You can go out and abuse it a bit before it like breaks down. An older car, you start abusing it, man, it's gonna fall apart on you. So stretching and warm-ups are key. Mixing modalities. One thing I do now that I never did is I'll have workout days where I really don't work that hard. Like I do what are called flush runs. Mm-hmm. So, I'm up to running like 10K pretty regularly now. So like I'll go run 10K and run it hard. And the next time I run out, I may run, 10K or less, but I'm running at a slower pace.
Yeah.
I'm just I'm getting the exercise in, but I'm not pushing myself. Like I'm doing flush, letting my muscles kind of get out all of the, byproducts that are built up. And I don't know, I think it makes a difference.
Yeah, I do the same thing at CrossFit, except it's like called, in CrossFit, it's called like RX, which is like as prescribed the workout.
Yeah.
And then you can do it scaled. So there's some days that I'll do RX and I'll like push myself to failure, like where you're like on the ground, you're about to throw up. And then there's other days because you have to, because if you keep doing that for so long, you're gonna get hurt. So I make sure to mix it up with like, okay, today I'm just gonna, take it easy. I'm not gonna push myself to failure today.
I mean, you may just be smarter than I am. I mean, because when I was like a young person, I'd go work out. It's like every workout I'm doing.
Well, I'm not a young person anymore.
You are a young person. You're pretty young.
I mean, I'm 4 years away from middle age.
Yeah, it's 4 years is a long time. But I don't know. It's something I never did in the past that I've started doing now, and I do think it makes a difference. In fact, I had to start doing it because when I first started this training session, I was again hitting everything really hard, and I just wasn't recovering.
Yeah,
I just was not recovering.
Out.
And that's one of the big things as we age, that your body does not recover as much. And so again, going back to, how to avoid injury, you have to be very active about your recovery. You need cool downs on your workout days, and you need recovery days in between where you don't do anything. And you need some workouts where you're just not like pushing yourself that hard. You shouldn't feel bad about your rest days. You shouldn't feel bad about your rest days, and you shouldn't feel bad about workouts where you're not pushing it to the limit.
Yeah.
Because it's counterproductive. When you're young, 20 years old or whatever, yeah, you can do that and you can sustain it. But as you get older, you can't.
Yeah.
You know, you'll end up injured.
Something that's like helped me because, I mean, I would try to go, you know, as hard as I could most of the time at CrossFit, but
Right.
slowly I realized that I needed to do scaled. But the thing that helped me was talking to ChatGPT. So I would tell ChatGPT what I did,
Dude.
and then I'd say, should I do this workout all the way? And then they would be like, no,
Yeah.
you should not do that.
I
That's so funny.
Yeah,
Never thought to do that.
I have to say too, I have like a whole ChatGPT set up for my workouts.
Yeah, so do I.
Yeah, I do.
I have it for like meal,
Yeah.
like workout and nutrition.
Yeah.
I have a little chat just for that.
Yeah, I've really kind of deep dive. You know, guys know I love AI, and so yeah, I have one that I have specifically for my workouts, and you know, helps me with like this training and stuff, which actually is going really good. Like I'll brag on myself. So I did a 10K this past week, and I set my personal record in 5K within that 10K. Meaning, because in the past I was running 5Ks, and so the 5K I ran, like the first 5K of that 10K was like my best.
Or how many miles is 10K?
6.2.
Okay.
Yeah. So the first 3.1 miles I ran at like my record. I was like, I don't know what it was. The last time I ran, I felt so good. Like I was just like, man, I really feel like I'm finally making gains. Okay. Back on topic here. Sorry. You do need to
stop
adjust
bragging.
your. Huh?
I said, yeah, stop bragging.
Well, I mean, when you get old, like you
You
don't
have
have
to.
these times where it's like you can actually say something. I did something good athletically. You do need to adjust your goal posts. You know, working out now, you know, in 40s, 50s is more about your health and less about aesthetics. I mean, yes, there is the aesthetics of it and looking good and all that, but you know, you just have to be smarter about it. You got to avoid those crazy intense workouts, and you got to like give yourself recuperation. So, you know, as I said at the beginning, train smarter, not harder. You know, that's basically the key to, you know, being successful working out at, you know, in your, you know, middle-aged years. Otherwise, you'll end up injured, and then you're not gonna be working out at all.
For real.
So yeah, good stuff. All right, let me recap down real quick, Brenna. Today, I was talking about a topic near and dear to my heart, is working out in middle age. Man, I hate even saying I'm middle aged, but it's true, it's true. So I've been training for a half marathon at the end of this year, and I noticed my body is just not doing what it used to do 5, 10, 15 years ago. Well, if you're working out in middle age, either getting back into it or starting for the first time, you do need to know that this is different than when you're working out when you're young. You have to seriously adjust your methods, or you can very easily wind up injured. Our bodies do not recoup as fast when we're in our 40s and 50s as they did when our 20s. So you need to adjust what type of workout you're doing. Maybe steer away from these high intensity workouts until you're really in really great shape. You need to give yourself plenty of recuperation time. You've got to be super serious about warming up and stretching. Things I never did when I was in my 20s, or very rarely did them, are critically important now, or you can absolutely end up with pulled muscles, torn tendons, things that'll put you in surgery and put you out of commission for a long time. And you got to adjust your expectations a bit, you know? Get up in your 40s and 50s working out. It's a little bit more about health, less about aesthetics, although the aesthetics is there. So just things to think about if you are going to work out and you're old like me, boom, not young like Sarah and Brenna. These girls are still super young.
I just look young.
I'm worried about my back and like bones, because being a former dancer, I just crack
right.
everywhere.
Yeah.
So I don't know.
It's
What's
funny you
to do with
mentioned that,
that?
because I was like a very, very serious athlete when I was young, and I've always just been kind of expecting that at any given moment I'm going to have like a hip replacement or something.
Yeah.
And so far, I feel pretty good. I mean, I'm, you know, 50, like that's not young, but
Yeah.
I'm still like kind of hanging in there.
Yeah, I've never broke anything, so.
I have broken some bones
Oh,
over the
I
years.
have too.
Yeah, I had to have 2 knee surgeries from a sports injury, which totally sucked. And
Well, I mean, I don't know. Sorry, continue.
No, I was just gonna say, you know, I mean, I still feel that a little bit. You know, I can tell, like I have my knee, but I can still do what I want. I mean, I said I've been running 10Ks like 3 a week, and my knee's doing fine. It's just I just notice it. I know that, you know, this knee is not. You gotta baby it a little bit.
Yeah. I was going to say, Brenna, I was a gymnast and I still crack everywhere. And
Body's just like, what's going
so
on?
far it hasn't bothered me.
Yeah, same.
But I think the thing is with exercise, it's like if you're not doing it consistently,
Right.
like whenever you get in your later years, middle age,
When you're about to die, like Dr. Hermann.
the Crips keeper. But no, like if you're not working out consistently, it's really hard to just start working out at 40s and expect to see an aesthetically change your body, because that's not going to happen.
Man, the thing I've noticed probably the biggest about starting this pretty, serious training session is my gains are so slow.
Yeah.
That's the thing that I noticed the most. I started running, I was like, oh yeah, I need to be running sub 8-minute, 5Ks within a month. It's like, my body was like, I don't think so. That's not happening. I mean, I can get there, I'm sure, but my body's like, no.
You should investigate peptides. That's what Somorlin's supposed to be for, is recovery.
Oh my gosh,
Muscle
I may have to do
building.
it. I don't know, I'm getting desperate. Although actually, as I said, this last run,
It really does help with
felt really good.
recovery. You'll probably gain muscle mass really easily.
Really, I've noticed that like my weight's creeping up a bit, but I look thin, so I'm starting to gain muscle.
Filling out.
Yeah. Well, it's just I haven't started doing the weights yet. I need to do that. It's mostly my lower body. All right. Let's move on. Good stuff, though. Okay, this one, file this under Ultimate Bad Choices. This is a segment about a surgeon who is facing jail time on trial for letting her kid operate on someone.
Ew.
This story is so crazy.
Is this America?
Is it in America?
Yeah,
It
did
is
this
not in
happen?
America.
Okay.
I don't think that this would ever happen in America today. Maybe in Florida,
Here's
but
my intern. It's my child.
yeah, no, this is nuts. So this is a female neurosurgeon or brain surgeon in Austria who is currently on trial for allegedly, apparently it's not alleged, she did it, but on trial, letting her 12-year-old daughter perform a craniotomy, which is where you drill a hole in someone's head on one of
Neuro
her
is
patients.
crazy.
Is that not insane?
That is so crazy.
Dude, it gets wilder. And by the way, thanks to my wife for showing me this story. So this happened in January 2024 at the University of Hospital Graz, which is one of the absolute largest hospitals in all of Austria. So this is a big hospital. This didn't happen in Podunk,
It didn't happen in the Florida of Austria.
No, it did not. This happened in like a really big, legit
Happened
hospital.
in the New York of Austria.
It did. So there was a patient that was flown to the hospital with a serious head injury after a tree fell on them, and had to have surgery. And part of the surgery was to put a pressure monitor in. And we talked about pressure monitors in remember our true malpractice story one, where the guy had the pressure monitor and they didn't look at it.
Oh, yeah.
Yeah, and he ended up getting locked in syndrome, which is really bad. So this patient needed a pressure monitor. So during this surgery, this neurosurgeon had her daughter with her, okay? And okay, that's fine. I got something to say about that later on, but okay, it's fine to have observer.
An observer.
An observer,
Cool.
right? So the things started going off the rails when the surgeon had her daughter actually scrub into surgery. So she went from watching, at the side of the room to, hey, scrub in, clean your hands with the surgical stuff and get into a gown and all of it like you're one of the surgical team, and had her there. And then things got really off the rails whenever the surgeon allowed her daughter to participate by drilling a hole through the patient's skull. So, you're not talking about, hey, I let my kid put in an IV, right? Because, I mean, they're both bad, but one is like super bad.
Yeah.
Like, you're not going to kill someone by putting in an IV the wrong way. You 100% can kill someone by drilling a dang hole through their skull.
100%.
Like, that's just insane. Not only that, the surgeon took the time to explain it to the daughter. Like, it wasn't just like, here, do this real quick. Like, explained it, showed the tools, which I guess is probably the right thing to do in the worst situation in the world, where you're letting a 12-year-old operate on someone.
I guess the surgical staff told on her.
Obviously, yeah.
Yeah, 'cause
They must
had
have
all
been
the-
trying to set a world record, like the world's
Like the
youngest surgeon.
Or the dumbest thing that anyone could ever do in their entire lifetime.
That's crazy.
So there is good news in this. The patient did fine. So there was no, direct injury to the patient that we know of due to this. But yeah, this is basically gross, unforgivable misconduct on the behalf of this surgeon who should know better. So I got a couple issues. I mean, I personally think 12-year-old is too young to be shadowing. My daughter, who actually wants to be a neurosurgeon, asked me just recently about, hey, can I come shadow you in surgery? I'm like, you're still a little young. She's about to be 15. I'm like, yeah, you're getting kind of close, but still a bit young. And there are age restrictions in a lot of these places. Like 16, I think, is a really common one that you see. So I don't know. I think even letting the kids shadow is kind of a bad idea at 12 because, I mean, they're just kind of a liability, honestly. And I don't know if they're mature enough to see things like, sawing someone's skull off. Allowing them to scrub in, though, that's just crazy. I mean, it's just a hazard to the patient. Like, you're putting someone in the operative field that has no training in the operative field and can actually affect the outcome, contaminate something.
And be a distraction.
Be a distraction, contaminate. I mean, there's a lot of things that potentially go wrong. But then allowing them to do the procedure, and especially one, again, such as a craniotomy, where the outcome of that can be death if it's done wrongly.
That's a pretty sensitive area, your head.
Your brain? Yeah, big time. I mean, it's just unforgivable. And then two, what you said about the OR staff. I mean, this surgeon put the OR staff in a super bad position because the OR staff knew that this was a really terrible idea. But then it's like, did they say something to the neurosurgeon who's pretty high up the food chain? Obviously somebody did because this has now become like a huge thing. This is basically a ludicrously stupid move.
Yeah.
I mean, this person ruined their career, basically. They got fired.
Good.
One of the other surgeons got fired, I guess, because they
knew about it.
Allowed it to happen. Mm-hmm. And not only that, she's on trial, and she's facing a year in jail, because even though there wasn't a bad outcome, she did put that patient in potential harm.
Yeah, she could have killed him.
Yeah, it could have killed him. So, I just couldn't believe this.
Not to mention, like, insurance involved. Like, the insurance was paying for that person to touch your head, not a 12-year-old.
Right, exactly. That's just a whole other aspect of it, like the legal part. I mean, without question in the United States, if this happened, that patient would sue the doctor and the facility for millions and millions of dollars and absolutely win without question. Mm-hmm. I mean, this is just, I just don't understand what that person was thinking, that surgeon. I mean, it's just...
They're like, oh, it's just like drilling a hole in a drywall.
Yeah, it's just...
You know how to use a drill, right?
It's just absolutely crazy. I mean, and you expect stupid people to do stupid things. I mean, but obviously if you're a neurosurgeon, you would think that you have to be...
Sometimes really smart people are kind of dumb sometimes.
I guess so. I mean, case in point.
Yeah.
Yeah, I don't know.
Like
maybe this one slipped
sometimes
through the
they
cracks
don't, like, especially like for situations that involve like societal norms. Like, it's not normal for you to do that. But in their head, it's like, oh, my child's very, like, this is normal. This is an easy thing. Yeah, go do this.
I don't know. Anyway.
I'm here. I know everything.
It's just absolutely crazy. So, all right, let me recap this one for everybody. So today we were talking about this absolutely insane story where a neurosurgeon in Austria let her 12-year-old daughter do a surgery, actually drill a hole through the skull of a patient in surgery. I cannot believe that this happened. So fortunately, the patient did not have any bad outcome from this, but obviously this is a huge, huge issue. I mean, first off, I think 12-year-olds a little young to be shadowing a doctor. Shadowing is a thing. High school students do shadow doctors as observers only, but the surgeon did allow her 12-year-old daughter to actually scrub into surgery and be part of the surgery team, which is a super bad idea. It puts the patient at a lot of risk for things like contamination or just otherwise being a distraction. But then even worse, unforgivably, let her 12-year-old daughter do a craniotomy and drill a hole through this patient's skull. Wow. So obviously this is a bad thing. Surgeon got fired, the assistant surgeon got fired, and now the surgeon is on trial and facing a year in jail for putting a patient in harm's way, even though the patient didn't have a bad outcome. So yeah, I don't know, file this under smart people doing really, really, really dumb things. I just can't believe this one. So anyway, good shit. All right. I think that's it, guys. You guys got any big weekend plans? Big stuff?
Not really.
Avery has her North State gymnastics meet tomorrow.
Exciting.
Yeah. So it's like the qualifying meet before like all state.
Awesome.
So it's a big deal.
Excellent. Wish her the best of luck.
Yeah, that's exciting.
Yeah, very cool. All right. Well, I guess that's about all the time that we have for today. Please leave us a comment if you would like us to do a topic over something that you want to hear about. And otherwise, we will see you on the next episode of Nip Talk.
Bye.